I'm Joe Shapiro. I am an otolaryngologist, associate professor of otolaryngology at Brigham and Women's Hospital, Harvard Medical School, and I direct the Center for Professionalism and Peer Support. I am really honored and glad to be speaking to you as a fellow physician. The idea is we are all so dedicated to the work that we do, and we're doing it in an atmosphere that can be really challenging at times. And what we're hoping to do with our program and through PRI and other institutions is to help change the culture to one that's supportive, especially after things go wrong, or especially after emotionally stressful events. Because that culture really is what has such a huge impact on the well-being of each of us as a practicing physician. At the end of the day, we as clinicians, we're people, and we feel things, and we care. That's why we went into medicine. And if we aren't feeling supported, if we feel alone, if we feel afraid, it's both awful for us as individuals, and it really can negatively impact our well-being. And in turn, it's also bad for patients and families, because you can't really give what you don't have. So how we are as a person, how we feel, is obviously going to translate into the kind of work that we do, in our case, clinical care. And the other is we've got to face society, and society at this point has the litigation system as a way to give judgment on our care. And we need to face that, if we can, from a position of integrity and a position of, if possible, resilience. Isolation is really devastating. We're very social animals, if you will, and feeling isolated is very stressful. So how to overcome that? Well, first of all, just having anyone reach out to you and offer peer support. Right there, you're having a peer say, I've been there. You're not alone. We say that explicitly in offering support. That is also the beauty of group peer support, where you're sitting with a bunch of other people who are going through that as well. So that can really decrease the sense of being alone. And so just being able to offer both types of peer support, like PRI does, I think really helps, again, give the peer a choice as to what would feel right for them. And I think some people we've experienced at PRI, they want both, or they really have a strong preference for one or the other. And I think we saw and have seen in PRI that it's wonderful to give that choice, because not everybody wants to sit in a group. But on the other hand, there's something very powerful about hearing from a group of people who have had similar experiences, and they have a lot of wisdom to share amongst each other in a facilitated way. We're trained to believe that self-care is selfish. And I think that's gotten us into a terrible situation in medicine that's part of the reason there's an epidemic of burnout, depression, and suicide. We see getting help or feeling emotions and needing help as a sign of weakness, when in fact, it's a sign of strength. But it's not what we know in terms of our enculturation. And the idea of peer support, the idea of taking care of ourselves, really, we hope, will change the culture away from self-care as selfish and towards, if you want to be a giving, hardworking clinician or any other practitioner, you have to take care of yourself. You can't do this if you aren't cared for.